So I recently had somebody reach out to me and ask me what we do for preeclampsia out in the EMS field. I thought it'd be a really good video to create. I know I have made a whole nother video about this, but it's so far back, I'm not even going to look for it. But let's talk about what preeclampsia actually is. Most people, whenever they think about it, they think of pregnancy or pregnant patients, and that's 100% correct. It is actually a complication of pregnancy, and it usually happens after the 20th week. So it's characterized by hypertension, and this hypertension usually goes on to just wreak havoc on the organs, specifically the liver and the kidneys. A really good mnemonic to remember whenever you're thinking about the signs and symptoms of preeclampsia is PRE, P-R-E. P stands for proteinuria, or protein in the urine, and this is just a direct effect of the hypertension affecting the kidneys and all of the havoc that is going on within the body. And then we have rising blood pressure, aka hypertension, and then the E stands for edema. Edema is like swelling. These patients tend to retain a lot of fluid. So the main danger that we worry about in EMS or out in the field is really preeclampsia switching to eclampsia. The main difference between the two is that eclampsia includes seizures, and eclampsia is actually a condition that could result ultimately in death, so we have to manage it. The first-line anticonvulsant for eclamptic patients is magnesium sulfate. So the main thing we want to do is stop the seizures and get that blood pressure down. Now, magnesium sulfate is a central nervous system depressant, so not only will it hopefully stop the seizures, but it will hopefully bring the blood pressure down. This just puts mom at such risk of a stroke and or death. But when it comes to preeclampsia, every department and service is different. There's usually parameters and certain numbers when it comes to like a systolic blood pressure or blood pressure in general to, okay, at this point we are going to administer magnesium sulfate. And I have seen a few patients in the back of the ambulance that have been diagnosed with preeclampsia prior to me picking them up, and they are prescribed different medications. There was one that was on a beta blocker, one that was on a calcium channel blocker. It just depends on what the doctor recommends for them. But yeah, that's preeclampsia in a nutshell. Main thing to remember is we don't want it turning into eclampsia, which ultimately we would have to treat with magnesium sulfate. And if that didn't work, we would have to go to some kind of benzodiazepine to stop the seizure. One thing that I completely forgot to mention is that mothers are actually capable of having preeclampsia up to 6 weeks postpartum, so be aware of that.